here we have Julie, and what we're trying to do is we're trying to do a lift for her. But I'm not just trying to do a subtle lift, but quite a bit, because she has a lot of redundant tissue, especially in her jowl area, if we can see this. So what she needs is a lift like this. So that's what we're able to achieve with COG threads, which are also polydiaxonal threads, but because they're able to hold on to the tissue, we get a better lift with these. So it's important to do our markings based on the vectors of where we're going to get lift. So if you look at Julie's face here, you'll see that a lot of the redundant tissue is in this area, and you want to lift back like this. But you also want a lift this way, so that the jawline, which should be a sharp, smooth jawline, actually has a little bit of pre-jowling sulcus. So by lifting this way and this way, you're able to get a decent lift, and a little bit this way. So these are the vectors we're going to work with. So it is a lateral lift and it is a upward lift. So superiorly and laterally is what we're trying to achieve with the threads. So how do we do the marking? So split the face into two areas, the upper part and the lower part. We're talking about the cheek area here. So let's take a small little line. Please turn this way, going this way. And we're going to need 2 COGs in the upper part and 2 COGs in the lower part, and we may also need a little bit coming through this way for this kind of lift. So see, by doing just this stretch, I'm lifting here. By doing this, we lift here. So the 2 COGs are going to be in the upper part. They're going to be at a V, and we'll take 1 point of insertion. How to determine the insertion is, if you pull at this area, the skin needs to pull up. Now if I do it here, this is of no use, neither is it here. You want all of this to pull back, so this is the best area. So I'll make a point right here. And from there, I'll be inserting my first 2 in this area. The second one would be, you want this to lift back like this. So if I do it here, you only get a pull on the upper part. Here is too low, so I'll take it on the middle, this kind of lift. So this would be the point of insertion. The only point to be careful about here is from the angle of the jaw, about 1 inch ahead or 3 centimeters ahead at the anterior border of the masseter is where your facial artery comes through. So we've got to be careful about that. So the facial artery will come through like this. So you've got to be careful. So if I take an insertion here, we're very safe from doing any arterial damage. And again, we need 2 COGs, and so we'll do a direction of a V. It is easy to bruise a patient with this because we're using either a 21 gauge needle or a 19 gauge cannula in this method. So there's always going to be some amount of bruising. So now that I've got these 2 points, we'll start with this 2, and then afterwards we'll see if the lift is enough. If not, we can come back and do another point right here where the COG's going down, so we get more of a superior lift. Now with that we've marked where we're entering from, what we need to do is take the needle that we're using or the cannula, and you can see that you have the length right here, and so you can just see. So if I insert here, this is going to go all the way till this area. Same thing here, because if you take a point 2 forward, what will happen is you'll end up not being able to insert all of the thread, and that is a problem. So this point seems ideal for me to get this kind of a tug. So what we do is give a little bit of anesthetic at the entry point for both the areas. So just a small little anesthetic, always wipe the area, and here we go. Slight sting, good. And you can see I'm raising a slight little bump, that's all. Do the same for the second point. Always cleanse and make sure again you measure, because you want to make sure that you have the right place of insertion. Now this is getting a little long, so I'm going to take a point a little behind from here, and that would be perfect. So I'm actually going to take a point a little further back in this area. Small sting, excellent. And erase a slight little. There we go, that's good. Now you can use an infra or vital block so that the patient is very comfortable throughout the procedure, or you can give like a local infiltration of the anesthetic. What you need to understand when you're using these particular threads is you need to make a port of entry. so that your needle or the cannula can slide through. So what I'm going to use So it really is dependent on the patient and how they heal. So this is the results right away. Now, because of the edema, it'll camouflage some of the results. But what we need to look is the jawline. There's definitely a sharpening to the jawline. The pre-jowl sulcus in this area seems a lot better. She seems to have a nicer lift here. The shadows of the mental fold are lesser. Even her nasal labial fold is much softer. She seems to have this nice upward curve to her lips. So all we've done is do about 4 COGs on each side. So that's overall 8 COG threads. And this is the result, and it's just going to keep getting better over the next 3 months, and that's when we'll see the full results. All right.